Assalamu alaikum wa rahmatullahi wa barakatuh. Our brothers in South Africa, thank you so much for giving us this opportunity to talk about the Palestinian situation and the impact of the siege on the health ministry and the health situation of the entire population of Gaza Strip. In fact, in Gaza Strip, we are 2 million population living in a 360 kilometer square. There is a siege imposed on our people in Gaza Strip, and the Israeli aggression is ongoing. Every now and then they are attacking civilians in Gaza Strip. Since the last March of 2018, the Great March Return started, and 30,000 Palestinians were attacked. They were peacefully demonstrating for their rights, but the Israeli snipers on the other side of the border decided to kill, and they killed more than 275 of them, while those who lost their limbs because of those attacks were more than 136. On the other hand, 9 persons lost their vision, and 3 medical personnel were killed at the same time. Usually, we have no electricity most of the time in Gaza Strip. This is affecting negatively the performance of the medical equipment of our hospitals. On the other hand, we have also shortage of fuel and shortage of salaries for the staff. The shortage of salaries and the poor economic situation in Gaza has forced some of the doctors to travel for good from outside Gaza to find a job opportunity outside. Of course, this is a negative impact on the health situation in Gaza. On the other hand, when we talk about those doctors who get specialized outside Gaza, some of them decided not to come back because when they call our colleagues here in Gaza about the salary situation, they will inform them that they are living in a hard economic condition. I think the best thing to do is to support the health sector so that we can stabilize the medical career and the medical personnel inside the besieged enclave of Gaza Strip. The other problems that we face on the health sector here is the psychological impact of the stress and the siege which is imposed on our people here. More than 200,000 Palestinians today are having psychological problems, and we have shortage of psychiatrists who are supposed to treat them. We have only one specialized doctor, and the rest of the majority are general practitioners who are trained to do this job, but of course we still need further psychiatrists to handle the issue properly in Gaza Strip. On the other hand, because of the Great March of Return, we have stopped the elective surgeries for a long time because we have only left the operation rooms of our hospitals to operate those cases which are acute. But that was on the account of the cold cases which already were suffering, and there had been long waiting lists in many specialties like cardiac surgeries, ENT, like orthopedic surgeries, and extra. Today, I am appealing to your kind personalities to extend a helping hand to the health sector in Gaza Strip because of the shortage of medication that we have today, which is touching almost 50% of the drugstore. And almost 50% also are there's a shortage in 50% of the medical supplies from our hospitals. We have also a problem in spare parts needed to fix the medical equipment in most of our hospitals. And with still further equipment are still needed because the performance depend on them directly to improve the impact of the health system in Gaza while handling our patients. You know, we do not have the milk needed for the children who have a diagnosis called phenylketonuria. They need a special milk. Without it, they will become mentally retarded. The patients who are having kidney failure, they need another treatment called erythropoietin. Shortage of this erythropoietin, they will suffer a lot, and certainly they will die. Without it, there will be more anemia in those cases. And there's another immune suppression treatment needed for those who have succeeded to have kidney transplantation. Again, it's not available in Gaza. Today, we are appealing to everybody of you. And of course, I'll seize this opportunity. Special thanks go to Islamic Medical Association of South Africa, Federation of the Islamic Medical Association, and to those who have launched the Poor Patient Fund during Ramadan time. Special thanks also go to the Gift for Givers Foundation and Jam'iyyat al-Ummah for their kind support to the Palestinian people. Thank you so much, and we hope that we will see you soon in Gaza. And please don't forget us in your prayer. Thank you so much.